I'll give a few more minutes for people to trickle in. All right, let's get started because we have a jam-packed agenda and I want to make sure that we leave lots of time for questions. So welcome everyone to our panel discussion, exploring ADHD in pop culture and the implications for diagnosis and treatment. My name is Erin Smith. I'm the Chief Marketing Officer here at Creyos Health, and I'll be your moderator for today's event. I'm joined by some incredible experts in cognition and behavioral health, and I'll let them introduce themselves in a moment. First, a little bit of housekeeping and just an overview of how today's panel session is going to go. We will be asking our panelists questions to get their perspectives on this topic. We'll then save about 10 minutes at the end of the discussion for Q&A. As you listen to our panelists, if you have a question, feel free to write it in the questions area. We'll try to address as many as we can at the question period in the end. As a reminder, the session is being recorded and anyone registered or attending today will receive the recording via email. To kick off introductions, I wanted to share with you a little background about Creyos. For those of you who don't know us, Creyos Health is a healthcare technology company dedicated to transforming how clinicians assess and manage patient brain health. Our platform of digitized cognitive tasks and online questionnaires helps providers measure cognitive and behavioral health more objectively, more reliably, and more efficiently. Founded by a member of today's panel, Dr. Adrian Owen, Creyos is backed by 30 years of research. We have been published in a number of different peer-reviewed studies, and we have one of the industry's largest normative databases. All of that has made Creyos a very scientifically validated and reliable tool to measure cognition. Now let's get to who you've all come to listen talk. I want to introduce our panelists, and I'm going to start from top to bottom as you see on our screen and have our panelists introduce themselves and give a little bit of background about their expertise. So Dr. Adrian Owen, why don't you kick us off?
Sure, thanks very much, and thanks for letting me do this. So yeah, I'm Adrian Owen. I am the Chief Scientific Officer of Creyos and one of the original founders and one of the people that really started developing the platform a long time ago, back in the late 1980s, in fact. My day job is a professor of cognitive neuroscience at the University of Western Ontario in London, Canada, which is where I am now. I've had an interest for more than 35 years in the assessment of cognition. I began during my PhD work looking at patients with neurodegenerative conditions like Parkinson's disease and Alzheimer's disease. And that's really how the development of the tests that now comprise the Creyos battery came about, because I was trying to find unique ways of assessing complex patterns of cognitive impairment in challenging disorders that are not easy to pin down, like neurodegenerative diseases. So, yeah, that's my background, and I'm very happy to be here. Thanks.
Dr. Jackson?
Sure. Thank you for having me. I'm Rebecca Jackson. I'm Chief Program Officer for a company called Brain Balance, and we work specifically with both kids and adults that struggle with aspects of attention, emotional regulation. So we work with a lot of individuals, both old and young, that struggle with ADHD. And our program is focused on understanding the complications that hold back development, that ultimately create negative impacts on our ability to sustain focus and regulate our mood and emotions. I've been using the Cambridge Brain Science Cognitive Assessment, which is now Creyos Cognitive Assessment, at Brain Balance for about 4 years now. And we brought this assessment in to our assessment package at Brain Balance because parents came to us knowing what the challenges looked like. They knew that their kids needed additional redirection, that they would get frustrated and upset, but they didn't always know why. And we knew subjective information from parents and measurements that we can do, but we wanted more concrete objective data to help us understand the unique combinations of relative strengths and weaknesses that individuals have. And then to me, what's really exciting about the work that we do and my personal interest and hobby is knowing that the brain can change, that concept of neuroplasticity, and understanding what is it that we can do to drive meaningful change that translates over into impacting attention and focus in the classroom, impacting relationships and an individual's ability to pay attention and execute. So my day job is Chief Program Officer at Brain Balance, and my hobby would still be understanding the brain and learning what we can do to create meaningful change for individuals. So I'm excited to be here. This is a really exceptional group of individuals that I think we could talk for hours. So I'm excited to hear what everyone has to say.
Thank you, Dr. Jackson. Dr. Jospitri.
Yes, thanks, Erin. Thanks for having me on the panel today. So I'm Dr. Jacques Jospitri. I'm a psychiatrist with a background in technology and business and a co-founder of Soho MD. Our practice focuses on doing very high quality care where we do biological psychiatry, looking at nutrition and endocrine issues that impact people's psychiatric symptoms. We also take a trauma-informed approach to our therapy. And by combining these two things, we have a very high quality delivery of psychiatric services, and we make it affordable for the average person. And we're really excited to talk about how we leverage the benefits of Creyos in terms of helping to identify different symptom domains that helps us do our job in diagnosing and treating patients. Thanks for having me.
And last but not least, Dr. Ratouche.
Hi, everyone. I'm Ed Ratouche, and I'm Jacques' partner at Soho MD. And I've had almost a 2-decade career in clinical practice using a very qualitative approach to the diagnosis and treatment of ADHD. And when I look on a personal level, like at my family, and I look at my kids, I start seeing certain symptoms, and I certainly don't want to jump to pharmaceuticals with them. And I'm increasingly interested in, as Dr. Rebecca pointed out, like the relative strengths that certain individuals have, and how to create an optimized emotional experience for kids by taking advantage of their strengths rather than identify them primarily for their weaknesses. So thank you for having me. Excited to learn.
Thank you for these introductions. Let's jump into the questions. So first and foremost, I'm going to start with you, Dr. Owen. ADHD is a widely represented condition in culture, from media to books, social media platforms, celebrity culture. As a neuroscientist who has studied the brain extensively and understands the physiology behind it, how accurate do you think the portrayal of ADHD is in pop culture, and are we doing the complexity of this condition justice?
Yeah, I think that's an interesting question, Erin. I mean, I think it obviously depends. I mean, in some ways, I think ADHD is portrayed well in some contexts. In other contexts, there's really an over-reliance on what I would call stereotypes or misconceptions. So I suppose some examples would be that I think in general, and this is actually, it's not unique to ADHD. I think this is true of many mental health issues. In the case of ADHD, often pop portrayals, if you like, will focus on things like hyperactivity and impulsivity, which are symptoms of the condition. But we also know that problems with attention and inattention are other important cognitive components of the condition that I think are often overlooked. I think another aspect, and I'll have to defer to my other panel members who are more expert in this regard, but I have the impression that in popular culture, ADHD tends to focus on the negatives,
Mm.
But we do know that some patients with ADHD have quite unique strengths, including creativity. High energy can, in some context, be a bonus. Thinking outside the box, these sorts of things. So I think there's also a tendency to focus on the negative. The other thing is, and again, I would defer to other experts on the panel, but I think there is a tendency to focus disproportionately on children. When this is a condition that, as we all know, can affect people at all ages, and it is often a lifelong condition for people. So the idea that this is a childhood illness and you could even sort of grow out of it is something that I've often seen in popular culture, which I think probably scientifically doesn't really do it justice.
Other panelists, thoughts, do you feel like it's over-indexed in terms of being portrayed as something that can be grown out of? Thoughts about how it's portrayed in popular culture?
Yeah, I would throw in that I think that two different buckets. I think the first thing is I don't think people fully appreciate how lifestyle and wellness affects how you function. So I think when people see symptoms, they look it up, oh, I have these symptoms. They don't realize that there's so many things that can create those symptoms. And so as soon as they have attention issues, other aspects that seem to be consistent with ADHD, they don't realize that it doesn't mean that you have the diagnosis just because you have that. That's part of the reason you have testing, you have full clinical workup to understand what the source is. And also other psychiatric symptoms, when they're not well managed, can also dramatically affect your attention. And so you want to have those things stabilized, diagnosed, identified, and addressed, and then see if you still have residual symptoms that are consistent with ADHD. And so I think people have tried to simplify it, and therefore I think it gets overdiagnosed and then not always properly treated.
And I think to the point of this conversation with the impact of pop culture and awareness, I think that TikTok trend of TikTok videos displaying hyperactivity, impulsivity, those are absolutely elements of ADHD, but those are two small elements to an actually very complex and involved condition. And as Dr. Jacques was mentioning, we all have environmental factors that chip away at our attention and focus. I always think of our attention and focus as very precious resources. And when we're tired or have high levels of inflammation or high levels of stress, it's harder to access those things. So absolutely all of us are going to have times of distractibility, of impulsivity, of emotional reactivity. But individuals with ADHD have that more consistently. And so it makes everyday life things harder. And so I think for parents and adults who find themselves struggling with these aspects, it's taking a step back to say, is this happening consistently, or is it just happening when I'm tired or facing high amounts of stress? And to what degree is it disrupting or negatively impacting my life? And that's where those objective measurements can help to really give us concrete information.
I want to move on to our next question because we have a few that we want to fit in a short amount of time today. Based on how ADHD is portrayed and what you've just shared in terms of that portrayal, how do you think that it's impacting people's willingness to seek treatment? And maybe Dr. Jackson, we can kind of pick up where you left off with your last point in terms of what's that like follow through implication?
Sure. A positive that I feel like has come from the pandemic time is I feel like we're more openly discussing some of these challenges with less of a stigma.
Mm-hmm.
So I from the Brain Balance perspective, we have more and more parents and adults calling, asking for help, asking for information, wanting to understand more. So I feel like the conversation is happening more publicly, which I think is really important. But I do think there is that focus on the hyperactivity, impulsivity side of things. And I see that in the stigma where a parent will come in and say, my child is the ADD, not the ADHD. And they're very specific of not the H component of things, not the hyperactivity component of things. And I do feel on the inattentive side of things, it's easier to miss. It's less loud and disruptive in a classroom, but we know individuals that struggle with the inattentive side of ADHD, there's a huge impact on feelings of shame, feelings of self-confidence and struggling in those aspects, knowing that I'm smart, I'm capable, but I have such a hard time delivering. So then starting to internalize those feelings of what's wrong with me? Why can't I do this when everybody else can? So I think there's a quiet side to ADHD that's harder to miss, therefore harder to support. And I think in pop culture, we really play up the hyperactive, impulsive side of things.
Has that played out when you see patients in your practice at Soho MD?
I think that the people who are coming to us are the people who realize that we can do something about it, right? It's a skewed audience because they've already bought into the treatment and understand that we're here to help support and make improvements. And I think that there's a larger audience who have even looked at ways of trying to avoid the structure of society, like for example taking their kids out of school. So rather than say my kid is having these issues, what are the things I can do to get my child better? Instead, or they talk about how the school system's broken, it doesn't work, and it's really the school that's broken and not the fact that my kid has these symptoms. And if the schools were different, then kids wouldn't have these symptoms. It's not neither extreme is 100% true, but this notion that that there are things we can do to identify, diagnose, and come up with good treatment plans that get the symptoms better so that kids can succeed at school versus saying, I'm simply going to homeschool and take them out of that setting. So I think that social media kind of has been pointing people in that direction, or even people saying drop out of school for older kids. Like that trend is also up there. And I think that, people can succeed when given the right tools and the right resources.
I think it was very astute of you, Dr. Rebecca, to talk about the emotional consequences associated with a child and or adult confronting their cognitive differences with people to the left and to the right of them. I think there's a strong emotional response, and I even think that there's a defense mechanism that's generated. I sometimes wonder if the impulsive ADHD child who is yelling and screaming is just the more assertive child who doesn't know how to let everyone know that they're struggling with their ability to hear and understand the same things that everyone else seems to be getting. It's almost flipped. The stuff that we typically associate the impulsivity, the behavioral things that identify children often, they're not ideologically at the center as much as the inattention and the cognitive challenges. And so I think that's super important because, by the time they're adults and seeking treatment, they've already developed an emotional framework that you almost have to penetrate to even access honest conversations about their cognitive history and cognitive challenges.
Okay. Moving on to the next question. Thank you so much, Dr. Ritesh. What challenges do you foresee in this climate, in this situation, knowing the influence of pop culture and what it is, as you've said, bringing kind of the baggage, I guess, that it's that patients might be carrying with them as a result of consuming all of this information. What do you foresee healthcare providers facing in terms of challenges when it comes then to accurately assessing patients for ADHD? Is there noise, I guess, that has to be kind of like broken through? And are you seeing patients coming, for instance, with these preconceived notions, and how does that manifest kind of in conversations? Dr. Jospitri, I'm going to start with you on this one and would love to get you to kick us off.
Totally. I mean, what's interesting is with search engines, people are self-diagnosing. They're looking up their symptoms, and they're coming in very confident that they know what's wrong, and they know what treatment they need, and they're seeking that treatment, and they get upset when there's other things that we ask them to do to help confirm whether or not that is really the diagnosis. It might be in the differential, but there's more work that needs to be done, and potentially the solution might not be a stimulant, for example. But in their mind, they thought that's what they needed, that's what they wanted. And the fact that, that it's not going in that direction sometimes will upset them. And so the education that has to go on with patients to help them see that there's a wide range of things that could be tied into their symptoms is part of the challenges that we face, given the way people are perceiving the diagnosis these days.
And I'd love to add to that and this was actually a conversation that Dr. Dos-Futri and I were having prior to starting this, is I think so often right now, so many conditions are looked at in a very siloed approach. And so if you are struggling with attention, what can we do to provide impact on attention? But you shared this, Erin, in your initial tee-up slide, is you use the term brain health. Mm-hmm. Brain health has an influence on our cognition, on our emotional well-being, on everything. And we know one of the greatest detriments to brain health is development, but we also know that what we eat and our environment also plays into our overall brain health. And so I think it's so important in this conversation that we remove the siloed approach to really look at the whole person, the whole individual, to say when we support improved brain health, we see change not just in the cognitive symptom or challenge that brought the individual to seek help in a conversation, but also in their emotions and mood and in the whole person.
If I can add to that, I mean, from a sort of neuroscientific perspective, I think one of the dangers here is that people often come into this situation with perhaps an inflated view about how medication may help. Mm. And, this is the sort of thing, it goes back to comments I made earlier about the simplification of conditions like ADHD, the way they're portrayed through popular culture in a rather simplified way. We also see people, receiving medical treatment, receiving drugs that sort of fix them. And, working from the neuroscientific side of things, it's always very subtle. Drugs can be helpful for some people some of the time, but they're very rarely the complete answer. And there's never, very, very rarely a magic bullet that, people can come in. And I think in some respects, social media sets up this expectation for some people.
Totally.
So kind of the flip side of that coin, to help combat that, are there specific strategies that you employ in your practice, in your organizations, to really get more accurate and be able to pinpoint a little bit what is really happening, and also what is the right treatment plan? Because prescription medication, that may not be the cure-all. And any guidance you can offer physicians or other clinicians that are attending around how they can kind of weed out a bit of the noise and get that precision in terms of evaluation.
I mean, I would throw in here, this is where we love using Creyos in terms of giving us, standard measures that are more objective and independent of any clinician. So mm-hmm. It's not about the clinician's interpretation of the data. This is a test that we do to identify, past trauma, depression, anxiety, other symptoms that are part of the diagnostic picture. And we also send labs on our patients. And most psychiatrists do not. We're checking nutrition, we're checking endocrine issues. We're really doing this full deep dive so that we understand all the data that's objective beyond just the subjective questions that we might ask, so that it really helps us build that robust diagnostic picture to identify the best approach to care for the patient.
And I'll just add, on a very qualitative end, even if all of this isn't done, to jump to pharmaceuticals, especially controlled stimulants, is just you have to really deliver on that intervention for it to be worthwhile. If a patient tries a stimulant and their feedback is, I think it's working a little bit, I tell them they should stop it, because that's not good enough. That stimulant better be bangbusters. Your life needs to feel completely changed for it to justify to take a medication like that at length, especially starting at a young age where you might really develop a coping relationship with it as you get into your professional years. So the fact that we have this treatment for decades now as the go-to is really kind of scary, that we haven't really developed competing interventions, because we need to more formally offer those types of things, because the chemical solution isn't a good one.
Mm-hmm.
Well, and we see that, look at the Adderall abuse statistics right now. And I want to be careful, because there is a time and a place. And if medication is making a difference, that is relevant and that is important. But I loved the way you just phrased it and I'm going to get it wrong, but talking about developing that coping mechanism strategy that can impact how you approach things in life. We are seeing high levels of Adderall abuse across the age usages, going down as young as middle school on up through adults in varying professions. And to me, this is where the hopefulness in this conversation comes in, is there are interventions, the work that you all are doing, that we're doing, that Dr. Adrienne Owen is doing to help us better understand neurology and cognition, is we are able to make change to the brain that can positively influence these things. And that's what we've seen in our research using the Creyos assessment tool pre and post, is we are seeing significant and measurable change that translates over into life. And so while we are at a point of, we've had a lot of the same approaches for decades, we're seeing increased rates of diagnosis in kids and adults, increased rates of medication usage, and people don't know that there are tools and approaches available. And so we need to let, in a larger way, people know that there are many different avenues forward, so people can find the right avenue and approach for them to help drive change.
I'm so glad that, sorry, Aaron, I'm going to say one more thing.
No, please.
I'm so glad that you guys are getting benefit out of Creyos. It's incredibly gratifying, because, I mean, our philosophy, and this goes well beyond ADHD, has always been, can we come up with, truly objective measures that can sort of take the decision making out of the hands of, the complex decision making out of the hands of physicians or carers or neuropsychologists, where these things are often very subtle and very difficult to sort of pin down. And it's great to hear that it's actually working, because we've spent decades trying to get this right. And I think this is a bit of a brave new world. I mean, what we're doing with ADHD is it's just one thing, but I think this move towards trying to really characterize complex neurological and psychiatric conditions, in terms of, in ways that we can measure objectively, is really the future, and it's what we're pushing towards. So it makes me very happy to hear this, guys.
Yeah, it's almost like an EKG for the brain.
Right.
Yeah.
It gives you that data that you can then make decisions with. It's a little bit more objective.
And the notion of objectivity is a great segue to the last question that we have for today's session before we take questions from the audience. I mean, social media is not going anywhere, obviously. And pop culture is not going anywhere. It's always going to be here. So in this day and age, in this world of kind of instant consumption and gratification and instant information, how can healthcare providers and the science community use these platforms, whether it be, I don't know, TikTok or I'm going to date myself, Twitter, or, so whether it be social media or TV or literature, whatever it may be, how can we use these platforms to foster a more informed environment when it comes to ADHD? And maybe, Dr. Owen, you can kind of start this one off for us.
Right. Well, I mean, I can obviously talk from my sort of neuroscientific perspective, which is, basically it's education. Use it as an educational platform. Use it as a means to provide people with accurate and evidence-based information. I mean, we're all very aware of the amount of so-called misinformation or disinformation out there, and it is very difficult to sort of cut through that. But I think people that know what they're talking about, have experienced this sort of thing, and have worked in this area, have I think they have a moral obligation to provide educational resources that people can use to try and find the answers as best they can. And I think what we're doing right now is a perfectly good example of that, to be honest, which is that we have people here that, perhaps myself excluded, know what we're talking about. And, we're trying to provide as much straightforward and clear information as we can that, hopefully will be beneficial for people either working professionally or patients and carers. So, that for me, along with, promoting awareness of these things, I think education is the big piece.
Yeah, and I would add to that, medicine's not a popularity contest, right? And I think people are getting a platform and they're feeling that they have authority because they're popular, right? That's not the same as having a scientific foundation, having, done the work, having an evidence base. And just like Dr. Owen was saying, it's us taking the time. We may not have millions of followers, may not have that sort of, status, but we have the authority of the training and the work and the experience to say things that I think people will hold in higher esteem than the people without those credentials or experience in terms of their claims. And so the more we're out there being, making, conveying this educational content and giving people, truly valuable resources and information, I think that will outweigh all the noise that exists in the marketplace right now.
Mm-hmm.
I kind of want to defend social media. Of course, there's a lot of noise. Everyone has an opinion, and everyone could be a voice on the internet. But some of the more recent experiences I've had on Instagram, for example, has been watching videos of couples showing you what ADHD looks like in that relationship. And while they're not credentialed folks, and I can't even vouch for the validity of their recommendations necessarily 100% of the time, but I could speak to the heart from which the content is coming from. It's pure patient advocacy, and it's those that love people with ADHD, their advocacy for recognizing that they didn't intentionally not say happy birthday or what have you. And I found it to be really endearing because, media's portrayal is, as we've discussed, it's this heterogeneous mix of not even fully ADHD behavior examples, but everything that people think might be. And then it's put through the, Hollywood filter. Whereas direct social media directly from someone's, apartment in the city, through COVID, having to deal with, someone all the time, you're getting what they really feel and think. And I found it to offer some more meaningful, real ideas about what it is to have ADHD and what it is to live with someone and love someone who has ADHD. And I got that on social media.
That's a fair counter perspective. We have some questions from the audience. So I'm actually going to call upon my colleague, Sonia, who's been curating the questions from everybody as they've been writing them in, to start asking some of the questions that we've received throughout this discussion. So Sonia, if you can unmute yourself and share with us what are some of the things that are on people's minds.
Yeah, thank you so much for this conversation. There were really great questions in the chat. The first one I'm going to pose here is, how can we differentiate between clinical inattention and inattention that's coming from factors about living in this fast-paced society, like the way that we consume social media, the ways that we're pressured to kind of always be busy and moving quickly in this society? What are some ways that clinicians are differentiating those two sort of causes?
Well, both are clinical, whether it's the environment or brain wiring. If there's a clinical impact, it's clinical. Now, whether it's one or the other, I think that's exactly where an objective assessment comes in. You could come up with your own tools and strategies. Well, I figure it out by doing X, Y, Z. but how scalable is that? How repeatable is that? How objectively reliable is that? And again, as someone who practiced, I think, good clinical work based on qualitatively doing things, I use myself as the judge and jury. And my patients are either going to be happy or very unhappy, depending on how good I am at doing that. But that's not objective. That's certainly not scalable. And it's not something that people could share with one another in a reliable manner to really enhance care at scale.
And I'll add to that, context matters. If you take a final exam, but you have a fever, you're sick, you're throwing up, your score is going to be very different than if you were healthy that day. And so when we want to understand what an underlying diagnosis is, we want to do it where we remove those kind of factors in your life, and that, like lifestyle wellness, it all plays a role. But we would say, what are the symptoms you have when you take out those factors? And then that helps us feel confident that you have that underlying diagnosis. But clinically, as Dr. Ratouche was saying, we would see it all as, these are symptoms you're dealing with, but your initial intervention would be focusing on your lifestyle and wellness. We would see what's residual and then decide how to move forward in terms of additional treatment from there.
And to continue on with that, it to me, it does come back down to that initial assessment, that initial intake. And it's a beautiful thing where I see the data telling a story. In that moment, when you're explaining the data to the parent, to the individual, you see the relief of this isn't just in your head. These particular tasks are harder for you, and we see it here in the data. And so I think of it as, the individual can paint a picture of what their life is like or what their child's life is like. And then we get to retell that story through the data, which validates and their concerns and feelings that this is real. But this is also, these are things that can be influenced and changed. We always say we measure what we can improve. It helps give us understanding, but then it also gives us that concrete apples to apples comparisons of, is this driving things forward in the right direction? Are we on the right track?
We probably have time for a couple more questions.
I'll pose another one here, just in continuing on the conversation about those lifestyle factors that might be at play. There's a question in the chat. While it may be hard to answer generally, what are some of the day-to-day things that people with ADHD can do to cope with common ADHD-related symptoms? What are some of the recommendations that you might make around those more lifestyle factors?
Sleep, hydration, exercise. That would be the starting point in terms of lifestyle, and just general nutrition, just eating a healthy, balanced diet, lots of vegetables. That all those things would help significantly.
And I would add to that all those things and balanced screen time. We are consumed so much by that, and it drains our resources. We spend a lot of our attentional resources scrolling through social media, scrolling through videos, and that drains our ability to pay attention later on in the day. And so replacing screen time with movement, exercise engages and stimulates and helps the brain pay attention and remember information. So it doesn't mean no screen time, but finding healthier balance in the lives of our kids and ourselves.
Continuing to build on that, there were some questions around a little more details on the types of, for Soho MD, you mentioned there are additional labs that are done. We've had some conversations around measuring nutrition. So for each of you, what are some of the additional kinds of tests and screens and information that you would seek out to understand what else might be interacting and influencing someone's ADHD symptoms?
Yeah, great question. B vitamins, huge. Folate, B12, looking at the levels, making sure those are adequate. Vitamin D, looking at trace minerals like zinc, copper, magnesium. And then in endocrine, we look at the thyroid extensively. So a lot of people look at the TSH, but you really need to look at the free T3, free T4 to make sure that that's functioning. So this is just kind of your core foundation of health that we review. To just make sure these things are fine. And what we find in a lot of patients is they're off. And by making these adjustments, we see that they get better, combining that plus whatever medications they might need.
And at Brain Balance, additional assessments and testing that we look at, we're looking at measures of development. So balance, coordination, we want to see the elements of is development on track, or for some reason has development veered off track? And looking at developmental milestones give us a sense of that. One of my favorite measures, in addition to the Creyos cognitive assessment, is eye tracking. Eye tracking technology is fascinating, and it gives us a sense of speed, accuracy, and endurance of the brain and fatigue. And a tired brain has a harder time paying attention. And so if we have less fine-tuned control of high-level functions, we see it play out in other areas as well. So it's getting that picture of the whole person to understand, again, those relative strengths and weaknesses and what we can measure and improve.
We probably have time for one more quick question, and then we'll wrap up.
Okay. For this last question, then I'll share one, which is that more and more, there's been an increase in adults being diagnosed with ADHD. Earlier in the conversation, we talked about how, some of these portrayals through media tend to focus on what this looks like for kids. What do you attribute the increase in adult diagnosis to? Are you also seeing that trend? And maybe to share a little insight into what those kinds of conversations sound like.
Yeah, I'll start with this one. One of the things that I've seen a lot is people with vitamin B12 deficiency. B12 is an intrinsic factor that binds it in the stomach. It gets absorbed in the lower down in the small intestine. And people, when they get that taken care of, their cognitive functioning improves. And I don't know why there's a trend of why people, like, in training, we were taught that it was very rare for people to have it. Usually it'd be people who had like alcohol abuse. Those were the ones who were most at risk for it. But people don't fully appreciate the impact that nutrition has on their cognitive performance. And that's the connection I've seen clinically. And so it's, I think the whole adult ADD thing is overblown. I don't think it's, I think that people have to look at their overall health to understand why their cognitive performance is going down, instead of just jumping to this quick stimulant solution.
I can speak from the perspective of what we see at Brain Balance is, as parents, we'll do more things for our kids than we do for ourselves often. And so we see parents bringing their kids in, and then as they go through that assessment discovery process, we watch that aha moment of, oh my gosh, that's me. And whether it's diagnosed or not, if there's challenges present, there can be an impact. And so I think as we've seen increase in awareness of childhood ADHD, and science has taught us that it's not something you outgrow, it is now thought of as a lifespan disorder, I think our awareness of childhood ADHD has increased awareness in adults in themselves as well.
Yeah, I would agree with that. And, look, I'm going to share some personal stuff. I think I had good nutrition. I ate red meat. My mom foraged for berries in the woods for me. And yet I grew up knowing I'm different, being accused of being lazy, having the worst presentations, all that kind of stuff. And my first official assessment was at the age of 20 while at university. And it gave me a justification for what's going on, but it still didn't offer me any real relief because the world is still not designed for people with my particular strengths and the list of my particular weaknesses. I did the best I could with what I had, but man, the image you have of yourself growing up is not a good one, because it doesn't make sense to you why you're not performing at a level that you think you should be able to perform. And it's frustrating. Like I said, I think sometimes the assertive kid becomes the loud and hyperactive one, and the less assertive kid just accepts this as their personal limitation, not something that could ever get any intervention for, not something that you could get any type of accommodation for. And, it's this, as you put it, Dr. Rebecca, Dr. Jackson, like, it's this eye-opening experience. You're like, wait a minute, I'm just like my kid. You just said my kid has all these things that are diagnosable. Well, I must have them too. That's a real reality in the last decade plus.
So we're at time, and I want to thank all of our panelists for joining us today and for the insightful conversation. I know there are some questions that we just weren't able to get to, but thank you. I appreciate everyone who was able to attend today and their engagement with our session. If you want to learn more about Creyos, get more content like what we've discussed in our panel discussion today, you're welcome to visit us and follow us on social media. We will be, and we regularly post more content like this and continue to engage in these conversations. So thank you everyone for attending today, and we're going to wrap it up from here. Look for a recording in your email inbox momentarily.
Thanks, Erin.
Thank you, everybody.